Hello everybody, welcome to Dr. Hosni channel. Are you wearing eyeglasses or a contact lens? Are you get tired of the glasses and the contact lens? If you have this issue, please join us for the rest of the video. So today we are talking about people who are wearing glasses and contact lens, and now you are get fed up of all these problems, like you are searching for your glasses, you don't find it, or the contact lens making you some eye troubles or allergy. There is other way, that's the good news, to have your error of refraction corrected. But before, it's a small hint about what's error of refraction. Is that the light, when it comes to the front of the eye, it needs to be focused to the very center of the back of the eye, which is the foveum. But some people are even short-sighted or long-sighted or having astigmatism. So they need to wear some corrective lenses in front of the eye to correct this. But there is other ways to correct this, which is refractive surgeries, which could be done on the cornea, which is like a glass watch of the eye, or the lens, which is the crystalline lines that naturally present in our own eyes. One of the most famous surgeries that are done nowadays is the LASIK. And the LASIK actually is just like abbreviation of laser assisted in situ keratomylosis. Yeah, I know it's a very big word, but the idea of it, it's like sculpting the surface of the cornea in a shape that allows the image that comes from outside the eye to be focused into the very center of the back of the eye. So if you are managing to have this surgery done for you, so you have to be asking yourself some questions. First, are you the right candidate for this surgery? And how you know if you are the right candidate? Yourself. If you are less than 18 years, I'm so sorry to tell you, you are not the right candidate. So sorry for my friends here who are below 18 years old. The other thing, that your refraction or your prescription measurement should be stable for at least 1 year. Another thing, that you don't have any serious eye diseases or severe dry eyes that actually is not compatible with laser. So when you decide to do that, you need to check the eye doctor to check your eyes for any signs that actually could be contraindicated for laser. Some people have a very thin cornea, and even they have some disease called keratoconus, in which the cornea is very thin and progressively getting thinner and thinner. Those patients are contraindicated for laser. Another thing, if you are managing to play a contact sport, like you're playing boxing, you're playing any contact sport, we are not recommended to have LASIK done for you. So the first thing, if you decide to do the laser and you be prepared for the operation, number one, if you are a contact lens wearer, so you have to stop wearing the contact lens for at least maybe 2 weeks before the operation, and that's for the soft contact lens. While for the hard contact lens, it might need much longer. Second, you have to be prepared by the doctors and his team by getting some measurements for like something called corneal topography, and the thickness, measure the thickness of the eye, and see whether you have dry eye that actually could stop you for doing this surgery, or it's just mild that you can cope with that. So at the day of the surgery, make sure you have one friend with you or somebody with you, because it's better to have that, because after the surgery you might be not having the best vision for this day of the surgery, so you need somebody to help you going home. Another thing, you will be taken by the nurse to check your vision again and to do some kind of measurement of your own glasses again, and they put anesthetic eye drops. The good thing about the LASIK, you will not have to be knocked down or having anesthesia for that general anesthesia, or even you don't have to have injections in the eye. It's just eye drops. That's all what we need. When you're being prepared, wearing your scrubs, and go to the room, you will lie flat, and we will open your eye with some metal thing. It's called the speculum. Actually, this idea is to keep the eye open apart, the eyelid, so that you don't close it at some stage of the surgery. The other thing, that the doctor will ask you to look straight ahead, like to a light or to a tracker, and keep looking at this like a point, so that you don't move your eyes with. There is a very nice thing, actually, it's not actually nice, but like it's some strange thing that you will smell some barbecue smell. Actually, this barbecue smell is not coming from the neighbors, it's your cornea being reshaped by the laser. So don't panic or don't worry about that. Another thing, you might listen to a very loud sound, which is actually the sound of the machine. Don't worry, this will take actually like 5 minutes for each eye, hopefully. So after you finish this, you will go back to assessment room and you'll be prescribed some eye drops for them. One of the eye drops you will take is anti-inflammatory drop, the other will be an antibiotic eye drop. You might be prescribed as well some lubricants eye drops in between. After you go home, you need to put these drops and you need actually to keep away from water for about maybe 1 week or so that like if you wash your face, keep your water away from your eyes. If you are over 40, that's the question. Is the LASIK suitable for you? Actually, the answer is a little bit you have to discuss with your own doctor, because some people, like definitely if you do the traditional LASIK, you won't be able to read except with eye glasses if you are actually elderly than 40s and you are presbyope. So to get rid of this, there is some ways, it's called presbyopic laser, but there is a lot of talk about it. Sometimes we say monovision, one of type they make one eye being a little bit short-sighted to see the near, one eye a little bit seeing the far. So you can discuss all this option with your doctor as well. At the end of the video, if you are going to have laser done for you soon, or you have a good experience or even bad experience with laser, please share this in the comments. And we'll be so happy to subscribe in our own channel and press the notification bell here and give us a thumb up, like down here. Thank you so much and see you next episode.